Yes, over the last 3 years, close associates of Maharaj and his servants noticed that there were some changes in his behavior, and there was also some cognitive decline. Maharaj has been known for his sharp memory and his deep insight and his intelligence, and as a repository of Srila Prabhupada's pastimes. And he's also known for his spotless character. However, we noted that there were some changes in his personality and behavior, and it seemed like there were some changes in his normal judgment. How he alerted us to the possibility that there may be some illness in his case. So that is when the investigation started. Maharaj had come to Dallas in May of 2024. So we had him see a neurologist, Dr. Heitzman, in Dallas. Dr. Heitzman gave him a diagnosis of dementia and started him on medications. He also, 24, recommended that he undergo comprehensive neuropsychological testing. So this neuropsych testing was then carried on by Dr. Rebecca Goodman in Santa Barbara. She made a diagnosis of mild to moderate dementia and possibly of the behavioral variant, frontotemporal dementia, what we will say called bvFTD. And when Dr. Heisman reviewed her reports and his own examination and evaluation of Maharaj, he agreed with the diagnosis of the behavioral variant frontotemporal dementia, or FTD. Variety dementia most of us are familiar with. In that, initially, memory may not be impaired. In FTD, what happens is the manifestations are mostly behavioral and personality changes. So we see that these patients seem to be acting or carrying on normally in their daily lives, but in situations which are more complex, which require them to have working memory or judgment, right, and complex decision making, we see that they fail. So what happens is externally, physically, they seem to be okay, but there are lapses in behavior and also in their functioning. The FTD Society has given certain criteria to diagnose FTD, and Maharaj fits most of that. First of all, we have to show that there is a neurodegenerative disease or problem which is consistent. So we have seen that. Along with that, there are certain other symptoms which include something called anosognostia, in which the patient seems to interact normally, but he has no insight or awareness about his actions. And so even though if you ask him, he will say, I have dementia, but he doesn't know what that means. He doesn't know what are the consequences of the disease for himself and for those close to him. What also happens after that is there is some inattention or apathy. So you see that he's not aware of his immediate surroundings. He used to be very astute in and conscious about things around him and had insight into people. But now that is lost. Along with that, there is what we call disinhibition. So in other words, they are not able to understand or behave appropriately. And in Maharaj's case, he has what we call passive disinhibition. In other words, he does not know how to protect himself from negative influences or negative people. And so we see that he was a victim of financial scams, substantial financial scams over the years, and also of elder abuse from someone who was a known perpetrator of elder abuse. So, and then they are also very suggestible. So like a child, they agree to whatever someone is asking them to say. So childlike. Also not so attentive. He's not as attentive to his own personal hygiene, and apathetic. He's not no longer as concerned about his say his diet, or he's not as concerned about what happens around him as he normally was. So like we said, these complex symptoms together, along with that history of this progressive decline, helps us make the diagnosis of the behavioral variant frontotemporal dementia. What I would like to say is that unlike Alzheimer's disease, in which you have memory loss primarily, frontotemporal dementia has changes in behavior um, and a lack of insight. And I would like to quote from the medical notes of Dr. Heisman. And this is a quote. He says, FTD is characterized by a relative preservation of memory, and instead characterized by a lack of insight and behavior problems. These features are not voluntary and are related to a neurodegenerative disease. He will need supervision in future, unquote. So in other words, the behavior which is uncharacteristic of Maharaj as we knew him when he was healthy is not him, but it is the disease. And he has no insight into his behavior, and these behaviors which are uncharacteristic of him, these are not volitional. So what we expect is there'll be a slow decline. Well, I shouldn't say slow. There'll be a decline, a progressive decline of his memory. And right now, his memory seems to be relatively intact, but we see that he's repetitive. He says the same things like after his Japa Sangha, no, may you be healthy, happy, and holy. So certain phrases that he can always repeat, that happens. And then the activities of daily living, which is like your bathing, your dressing, your grooming, ability to eat, to toilet, that gradually becomes lost. And ultimately, the person becomes bedbound and is not able to move. Also, further, he may have difficulty with speech. Right now, he has some difficulty finding words or expressing himself, so that gets worse. And then ultimately, the involuntary movements will also decline. So there may be difficulty in swallowing. And finally, because of that, they may not be even able to swallow their saliva. So they aspirate or choke on their own saliva, get pneumonia. And this is how mostly these patients leave their body. They are also more prone to get infections, like urinary infections, which leads to a generalized infection, what we call sepsis, which leads to death in these people. Yeah, so in our allopathic medicine, there is no cure for this disease. It's a progressive disease without any cure. The lifespan is about, say, from the time we get the symptoms to diagnosis is about 3.6 to 3.6 years. And then from the time of the symptom onset to demise is about 2 to 8 years. So basically what we are looking at now is about 2 to 4 years. These are just, like ballpark figures, and every patient is different. So we can just kind of give a prognosis as to how long people with this disease live and how they progress. We have to understand that Maharaj's illness is complex and difficult to understand. And we pray that the community of Vaishnavas will approach it with compassion and informed understanding.